Hi, I am Dr. Ajay George, Specialist ENT working at NMC Rola and Buhaira. Snoring is that obnoxious sound which is produced by the vibration of the flappy tissues in the airway. Whenever there is obstruction in the airway during sleep, the body tries to overcome that obstruction with force, and that produces the sound of snoring. Snoring can be associated with another dangerous condition known as obstructive sleep apnea, in which the oxygen levels of your blood come down during sleep, and because of that, your brain and heart can get affected. So, what should you do if you have snoring? First and foremost is to achieve the diagnosis. And the cornerstone of diagnosis of snoring is a test known as the sleep study or polysomnography. You will be required to come into a hospital and sleep overnight in the sleep laboratory. Over 50 to 60 parameters of your body will be assessed all throughout the night and then analyzed. At the end of it all, we have data on whether you just snore or is there any fall in oxygen. If the oxygen level falls, how low does it fall? How long does it stay low? And which all organs of the body get affected in which way when the oxygen level falls? At the end of this all, we have a conclusive diagnosis of obstructive sleep apnea. The next step is to find out where is the obstruction. The obstruction can be anywhere from the tip of the nose to the start of the lungs. It could be a deviation of the nasal bone called deviated nasal septum, or thickening of the tissues in the nose like turbinate hypertrophy. In children, it can be because of tonsil, adenoids. It can be because of polyps in the nose. It can be because of any tumor in the throat. It can also be because of the shape of your face, especially that of the lower jaw bone. So once it can also be because of some kind of systemic illnesses like hypothyroidism or allergic rhinitis. Once we know the cause of the obstruction, if it is something which needs to be treated medically like hypothyroidism, we need to start on medications. One of the cornerstone of management of obstructive sleep apnea is to get the body weight into the normal range, that is a BMI below 25. You might also need to tone the muscles of your body by various exercises. Yoga and pranayam can also help. If we have a definite cause of a static obstruction somewhere in your airway, you might require a surgery like septoplasty for the deviated nasal septum, or polypectomy, or tonsilloadenoid resection. Sometimes we might even need to do a surgery to widen your airway, a surgery which is called uvulopalatopharyngoplasty. Many times patients cannot be operated upon, and in that case you would need to use a machine which is called CPAP or BiPAP when you sleep in the night. This machine helps you to overcome the obstruction in the airway and also maintains the oxygenation all throughout your sleep. So if you have snoring, don't ignore it. Get it assessed, get it diagnosed properly, and follow the treatment given by your doctor.